clinically, these are some of the things that we do. Periodontal disease is a big one. This is a big percentage of what I treat. There's a lot of different techniques that we use, but one thing we're considering for this next year is actually doing a meeting with hygienists. So it's something to start thinking about with your hygiene. We've actually gone through a course this last year. We had 4 separate all-day meetings on how to set up a good hygiene recall program. And it involves a number of different things that I would love to go over with an office if you guys know any hygienists. And probably this next year we'll set aside some time to do that. Maybe you could help me a little bit. So, has anyone heard of the pinhole technique? I don't do that. I've never gone out, never taken the course. So I can't even use that word. But I use a technique where I make 2 little dots above the gums, and then I come down and pull the tissue down between the teeth. What's nice about it is there's no incisions. A lot of times they don't even need any sutures. But you can see I don't know if you can see with the lighting here, but there's quite a bit of recession. And then 3 months later, it's a nice way of treating it very conservatively with good results, no donor tissue from the palate. The big reason that people like this technique. If we're not able to do anything with the teeth or gingiva, I do have a technique where I can adjust the lip. So if you know anyone that has a high smile line that shows lots of lip, we can actually bring the lip down now also. We do have a 3D scanner at the office. What I like it for is facilitating the treatment planning process, because I can take a scan and then sit down right with them afterwards. The patients do like to see the 3D image, at the same time that we have the consult. It takes 12 seconds. What we do is we take a preliminary scan if we're going over implant case, but if we're working with a prosthodontist or someone, if it involves computer-guided surgery and different things, there's no charge for a second scan, and it just helps facilitate the process. But we can get a lot of good information really quickly that way. I found it very useful for diagnosing pathology. A big part of what I do is endo versus perio lesions. So Dr. Jordan and I have the exact same scanner, so we're sending them back and forth. Whoever comes first, starts on it, and then usually we both end up seeing that patient. Really good for sinus and for implants, and also for just studying the bone morphology on periodontal defects. Sometimes it will change how we approach it. And what's nice about the software is you can place the implants, and then I'll work with a lab where they'll have the wax up so they can actually insert the crown, and then it creates a nice digital workflow. One thing that I do is ridge augmentation. So if the patient's missing bone, we can make it wider with ridge split grafting. It's one technique. Another technique is with membranes. I use titanium membranes to help rebuild the ridge. And then with computer-guided surgery, what's nice about the 3D, mixing it with how we take our scans, is it gives us multiple options for how we can help replace the teeth. One nice thing about the computer-guided surgery is that if there's a very narrow space, we can place the implants very accurately in tight locations. So one thing else to do is sinus augmentations. I use 2 main techniques. One is the internal sinus lift, where I create an initial hole for the implant and lift the bone up. Another technique is where I come in from the side and do a bone graft this way. So the lateral window, you can get more volume with it. But the advantage of the internal sinus is that it's a quicker healing and less post-operative swelling. So that was the Facebook version of what we do. And this is the number one thing. Does anyone know what the number one reason patients choose a dentist? Not the number one. Not the number one. Insurance or cost. You can kind of in that. If you wouldn't have to worry about insurance if you guys didn't charge for your work, it wouldn't matter. But insurance is number one. Number 2 is location. So I'm not suggesting you guys change either of these 2 right tonight. But the third one, you guys know what the third one is? You guys had it. It was referrals, positive reviews. So this was a study from Dentistry IQ, and I believe they questioned 500 different dentists, or 500 patients. They asked, what's the main reason that you choose a dentist? But patient positive reviews is really big. I went to a meeting in Atlanta recently, and it was a 2-day marketing seminar, and multiple people that were at that meeting brought this up. They said positive reviews is very important. That's the number 3 reason. But if you're not going to move, and if you're not going to change insurance, I'd say this would be a really good thing to focus on. It's kind of a loaded question when you just say, well, just get a positive review. So I'm going to leave that up to Larry. If you can take, you got to give away the prize. But Larry, if you can give all of us, we would like to have like 100 written reviews and maybe 20 video reviews this next year. So
from me,
if you can line that up step by step, so that can happen.
I'll start working it.
I know positive reviews is big because when you refer a patient and the patient says that if you guys give me a review before the patient walks in, that's the number 1 reason that they're there, and they're basically willing to do what needs to be done from that point. So you guys have made my life easy when you do that. So this is, you need to take it from here, Larry. This is all I have. I wanted to just leave it there. There's nothing after that.